Welcome to our first lesson, Healthcare Fundamentals. Whether you're a student or you're preparing to take your licensing exam, we'll help you achieve your goals. In this lesson, we'll introduce you to the largest area of medicine, primary care. As we begin, we will review the fundamentals of healthcare and progress to more advanced subject matter in later lessons. A primary care provider called a PCP, or a general practitioner, is also known as a family physician or internal medicine provider. This is a physician who treats a wide variety of health conditions. A PCP is responsible for conducting routine health maintenance and screenings for their patients. These providers are qualified to treat entire families of people throughout the various stages of their life, including the delivery of a patient as a baby, treating childhood medical issues, along with adult conditions and elderly care referred to as geriatrics. However, internal medicine providers do not typically practice obstetrics, or the delivery of a baby, although they may. In fact, in order to become certified as an OBGYN and deliver babies, a medical school graduate must complete an internal medicine residency first before they can enter a fellowship to specialize in OBGYN. All PCPs must complete 4 years of medical school, along with 3 years of residency before attaining board certification. After the residency, providers can choose to complete additional training called a fellowship in a variety of subspecialties like geriatric medicine, sports medicine, orthopedics, adolescent health, or pain management, just to name a few. The role of a PCP is to provide comprehensive medical care and recognize situations in which their patients need to be referred to a specialist. They also serve as the coordinator of care and a medical chain of command. They provide preventative care by doing routine health screenings and health counseling. Many primary care providers will choose to work in private practice, but they may choose to work in other settings like emergency rooms or urgent care centers because they're trained to treat a variety of conditions. A private practice physician is one who works in their own office outside of a hospital. A hospitalist, though, is an internal medicine provider, or we call them an internist, who primarily works in a hospital providing the basic health needs of patients during admission to the hospital. Many PCPs will work both in private practice and inside a hospital, depending on their specialty. Now that we have reviewed the introduction to primary care, we're going to talk about the goals associated with it. In many areas, especially rural ones, obstetrics and pediatrics fall under the purview of family medicine practitioners. In these areas, family physicians will provide additional services like pregnancy care, women's health screenings, newborn checkups, and pediatric care. Because the goal of the PCP practice is to diagnose and treat a wide range of medical conditions, they must be well versed in common diseases and other complaints. Additionally, PCPs serve as the point of integration between all aspects of a care team and routinely communicate with physicians in other specialty areas in order to ensure quality of care. This becomes very important for complex patients with comorbidities, including those that have a significant disorder like diabetes, who routinely visit other specialists like endocrinologists, nephrologists, and podiatrists. It's the responsibility of the PCP to keep track of any labs, tests, prescriptions, and other services provided by the other specialists. This helps to ensure the quality of care and to avoid redundancy. As we already discussed, primary care providers can specialize in a particular area of medicine. This subspecialization can be based on a specific body system, a disorder, or by the age of the patient. For example, an adolescent medicine specialist, also called a teen health specialist, has completed additional training in the health issues that are specific to teenagers. Some of these issues might include behavioral and social health, sexually transmitted infections or STIs, drug and alcohol use in teenagers, and reproductive health counseling, just to name a few. Geriatric medicine specialists have special training in the aging process and the specific problems of the elderly. They usually have experience in rehabilitative care as well, and they may work in a private practice office or in a long-term care facility. Palliative or hospice care physicians specialize in the comfort of patients with serious or terminal illnesses. They generally work to maximize the quality of life for their patients and their family by helping them cope with the stress and symptoms of their disease. Pain medicine specialists work with patients who have acute or chronic pain and diagnose and treat causes of the pain. They typically work closely with other specialists, as well as cancer patients and those with serious debilitating conditions. Sleep medicine specialists focus on diseases that disturb or diminish sleep quality. They have additional training and understanding of how other illnesses may affect sleep and the sleep-wake cycle. A sleep medicine specialist may conduct sleep studies to diagnose things like narcolepsy, which is a disorder that causes sudden and unexpected sleep and daytime drowsiness, or to diagnose sleep apnea, where the patient stops breathing while asleep. Sports medicine specialists diagnose and treat diseases or injuries related to sports or exercise. These providers often work with different populations of athletes, including various members of athletic teams at the high school, college, or professional level, as well as individual athletes in varying sports. Sports medicine providers work closely with other clinical professionals like physical therapists or athletic trainers. Some PCPs can specialize in addiction medicine for recovery and treatment of alcohol or drug use. Also, they can specialize in brain injury medicine following a traumatic brain injury, which we call a TBI, or emergency medical services, among others. A primary care team is not limited to just the physician. PCP offices rely on a variety of other providers and administrators to operate smoothly. Advanced practitioners like PAs or physician assistants and NPs or nurse practitioners are essentially members of the primary care team. In many cases, they see patients as primary care providers and have similar responsibilities to physicians, like monitoring a patient's health and aiding in the management of any chronic conditions. The education for advanced practitioners includes a 4-year bachelor's degree followed by either a PA or NP school. NPs, though, must be a licensed registered nurse. Both may choose to then complete a residency to further specialize. PAs and NPs are able to diagnose and treat patients, write prescriptions, and order diagnostic tests. In some states, nurse practitioners are even able to practice independently, while others must work in a practice directly supervised by a physician. Most PCP offices employ registered nurses and licensed practical or vocational nurses. Nurses perform patient intake, which includes a brief assessment of the patient. They obtain vital signs and establish a brief history, especially if the patient has a presenting complaint. Nurses may assist providers with procedures and patient exams, perform basic laboratory tests, and educate patients about their prescribed treatment plan. Medical assistants perform administrative, clerical, and clinical duties in primary care offices. They may also assist in procedures and patient exams, perform basic laboratory tests, and educate patients about their prescribed treatment plan. All medical offices have administrators and billing staff, in addition to their clinical staff, to keep the office running smoothly. Their duties include patient scheduling, completing paperwork, and contacting insurance companies, among other things. Although social workers typically do not work within the medical practice, many PCPs have a very close relationship with a social work team. Social workers are involved in dealing with problems such as child abuse, elder abuse, domestic violence, as well as food insecurity and homelessness. This helps improve the long-term health and well-being of all patients. There are two general models of medical care. Disease-based care focuses on treating an illness, disease, or injury. And this is how most people view healthcare. The second type of model is the preventative-based care, and it attempts to modify or eliminate risk factors and promotes routine health maintenance through regular screenings to avoid potential disease from developing. This model of patient care prioritizes long-term provider-patient relationships. Primary care providers are crucial to preventative care because they are the providers who consistently see the patient routinely and monitor their ongoing health status, whereas specialists normally only see patients as needed. If they do see a patient regularly, specialists are generally concerned with the patient's issues that fall under their particular specialty. Preventative-centered care provides many benefits to patients and society, with healthier patients living longer and fewer chronic conditions, which translates to less money spent on healthcare costs in the long run. This is accomplished through routine screenings performed on an annual basis, including a basic or complete metabolic panel that we abbreviate a BMP or CMP, along with a complete blood count, abbreviated CBC, which checks for initial signs of many different diseases that would otherwise be asymptomatic in many patients. An annual wellness visit is a major component of preventative medicine. This allows PCPs to monitor patients for changes in their health through routine screenings and to provide regular education for good health. At the time of each wellness visit, a complete medical history, along with a review of systems, a mental health screening, physical exam, and routine diagnostic blood tests may be performed. Based on the assessment findings, the provider will discuss ways for the patient to improve their health. During every office visit, the patient's weight and vital signs will be obtained and documented. This allows for comparison over time from previous visits. Pain is also assessed on a scale of 1 to 10, with 1 being very minimal and 10 extreme. The patient's medical history will be obtained at a new patient visit, then updated yearly or as needed. Any changes to the medical history from the last appointment will need to be added. The PCP will normally review and confirm the previously documented past medical history with the patient, which may include any current or past medical conditions, along with their surgical history, obstetric history for females, family medical history, social history, medications, and their vaccination status. The patient's past medical history should cover their entire life from childhood to the present. Their surgical history can provide further details about a patient's health and additional medical conditions. Family history screens for major health conditions that tend to have genetic risk factors. Obstetric history for female patients includes details concerning any pregnancies and childbearing histories. It also includes the age at menarche and current menstruation status, including the date of her last period, along with any abnormal bleeding. It's also necessary to document if the patient has gone through menopause. A patient's social history includes information about their habits and life that can place them at higher risk for certain conditions. The social history includes tobacco, drugs, and alcohol use, sexual history, marital status, domestic violence risk, diet and exercise, and occupational history. Additional subjective data obtained from the patient includes a review of systems. This is a line of questioning to screen every body system for symptoms of disease. Typically, the integumentary, respiratory, ears, nose, and throat, cardiovascular, musculoskeletal, neurologic, psychiatric, genitourinary, gastrointestinal, endocrine, hematologic, and immune systems are covered. The patient will also be asked about the medications that they take, both prescription and over-the-counter, including any supplements and vitamins. Because medications prescribed by other specialists may adversely react with other medications patients take, it is crucial that the PCP reviews and evaluates the current medication list at every visit to avoid a potentially life-threatening interaction. An annual visit is also the perfect opportunity to monitor for common mental health disorders, especially depression and anxiety. Many providers administer surveys and ask questions to categorize patients as either high or low risk for mental health disorders. A patient's functional ability is particularly important in the elderly and is a mandatory assessment for those covered by Medicare. It screens for hearing impairments and evaluates the patient's risk of falling. It may also assess a patient's ability to perform activities of daily livings, or ADLs, as well as their home safety. After subjective information has been obtained from the patient, a complete physical exam is conducted as part of the annual visit. This assessment covers over 100 markers of bodily health and function. During the exam, the provider will focus on any parts of the body the patient may have a specific complaint or issue about. After the exam is complete, the provider may order routine lab tests and possibly other screenings. The provider may also determine that these tests and screenings need to be repeated at a future time. Recommended screenings typically include yearly blood work, a mammogram for females over the age of 40, colonoscopy for individuals over 45 years of age, a pap smear for women over the age of 21, and possibly STI testing for sexually active individuals. Laboratory blood tests evaluate the patient for a large number of common disorders, some of them very serious. These tests are fairly rapid and inexpensive, making them very efficient. Common types of blood tests ordered include a CBC, a chemistry panel, either a BMP or a CMP, a lipid panel, liver function test, a thyroid panel, A1C for diabetics, and coagulation panels for patients on blood-thinning medications. Other more specialized tests may be obtained based on the patient's history and review of systems. Providers will also ensure that the patient's immunizations are up to date, and if not, provide them with the option to receive missing vaccinations during the visit. Childhood immunizations are completed on a schedule determined by the American Pediatric Association. Flu vaccines are done annually, and there are also a variety of other vaccines available, including the pneumococcal and shingles vaccines. Once the provider has finished gathering all of the subjective and objective information they need during the visit, they will typically discuss ways to improve health with the patient. This includes a variety of advice and is highly individualized. The provider will likely mention ways to improve diet and exercise, review any prescription medications, and encourage patients who smoke to quit by providing them with the tools and information they need to succeed. Providers will also compare the patient's current state of health to previous visit notes from other visits in the electronic record or EHR. This will assist the provider to better evaluate how a chronic condition is being managed, how any long-term symptoms are affecting the patient, and if there have been any drastic changes in the patient's health recently. Previous lab tests and other study results can easily be referenced as well. It is also important to evaluate social determinants of health for each patient during their visit. Social determinants are conditions in the patient's environment where they live, learn, work, play, worship, and age that have the potential to impact a wide range of health, functioning, and quality of life outcomes that are difficult, if not impossible, to control. Social determinants of health include access to resources, quality education, healthcare, employment opportunities, transportation, public safety, social support, exposure to crime and violence, socioeconomic environment, language and literacy, culture, and access to technology. Perhaps the most important social determinant is access to resources, including adequate food, drinkable water, and suitable shelter. For instance, a patient may reside in a food desert in which there is a lack of affordable and nutritious food. These areas may have a significant number of fast food restaurants and convenience stores, but very little nutritious food is available. People in these food deserts are restricted to high-calorie, low-nutrient foods that are associated with obesity and can lead to the development of serious disorders like diabetes, hyperlipidemia, hypertension, and heart disease. Another important resource that can significantly impact health is access to transportation. This can include public transportation or other community sources that assist with transportation. A lack of these services would make it difficult for some elderly patients or for those with impaired mobility to travel to their healthcare provider for routine visits. Inadequate transportation can also make it difficult for some people to obtain food because they can't get to the grocery store. Education level is another major social determinant of healthcare. There's a very strong correlation between education and health. A higher level of education tends to increase a patient's lifespan and decrease their mortality rate. Better education normally results in better employment opportunities, including better benefits like health insurance and time off for medical appointments. This also helps reduce the rate of poverty. Recently, advancements in technology with the introduction of personal computers into the home with widespread internet access has impacted health because many medical offices require booking of appointments online. It's also easier to find a provider online. Additionally, access to insurance marketplaces is almost exclusively online, as well as making it difficult for people who do not have a computer or those who are unable to navigate the internet to determine what their coverage is or to file a claim. Providers must consider these factors when developing a plan of care. The patient must be comfortable and in agreement with the treatment plan. This will make it more likely that the patient complies with the provider's recommendations fully, which will improve their overall health.